My role as a pharmacist has taken a variety of different paths in my career. I started as a hospital pharmacist and then went into community pharmacy practice. And then the one that really, I think, changed my life was when I went to work at a state level in association management that opened avenues for different possibilities. Then I ended up from there into the pharmaceutical industry for 22 years with a variety of different positions that I had talked about before. And now I have my own consulting company around advocacy. So it's what you want to make of it as an individual and as a pharmacist, and where you actually see the need within healthcare. But I've been blessed to have a great career for this length of time.
My name is Bob Schultz. I'm an outcomes researcher within the pharmaceutical industry. The company that I work for, Takeda, it has a portfolio of medicines in several therapeutic areas, and I'll conduct observational research in databases that investigate the clinical and economic benefits of our medicines. So that's about what I do in the pharmaceutical industry in short.
I can use my clinical skills and scientific skills as a pharmacist. What really comes into being of importance is the ability to communicate abstract or scientific clinical data to the medical community or to patient organizations in an easily understandable manner. So it's the ability of having that scientific clinical background to understand clinical trials, to understand things that are going on with a medication that enables me to give a unique perspective as a pharmacist to an industry committee that may not have that.
In order to come up with ideas or research questions for us to investigate or to really understand the clinical and economic benefits of our products, I have to have an understanding of the clinical pathways and the clinical benefits that our product elicits. So I'll work with my medical directors, usually MDs, sometimes PharmDs, sometimes PhDs, and have these questions about the medicinal benefits of our products. And so it's very helpful to have a good understanding of mechanisms of actions and different outcomes that we'll be searching for. And having a clinical background as a pharmacist is very helpful.
If you're talking about the pharmaceutical industry specifically, then you're looking at roles, whether it be in the medical affairs side or the commercial side. You're really looking at roles like the medical science liaison or regulatory affairs or advocacy, like what I did with patient and professional relations, health informatics, government affairs, even legal. I know pharmacists who have a dual degree as a lawyer who can go into legal. You also are able to get into business development, marketing, sales. It's a wide plethora of roles anymore within pharma.
I think pharmacists and PharmDs have a very good clinical understanding of both the front end of things, being able to work in a pharmacy, and also the back end of things of understanding how a drug actually works and how a disease, pathology interacts with drugs in a human body. So pharmacists have roles in medical information, being able to communicate kind of guidelines and drug information, medical communication, being able to relay a lot of information back from external stakeholders who are asking, all the way through outcomes researchers like myself and even medical directors. So the PharmD is an excellent background to have in the pharmaceutical industry.